Hi, I'm Dr. Charlie Schuster, Clinic Director here at Back to Health in Charleston. I'd like to just tell you a little bit about something we're so excited about in our clinic. We've been doing it for a little over a year now, and it's spinal decompression. We've had some of the best results using this therapy with our patients, and we want to introduce you to what a free trial will look like if you're qualified and have had disc problems. And we want to just kind of go through how this would work when you come into the clinic. First of all, we want you to know that when you qualify for this, it's because you've had no luck with self-treatment, exercises, or maybe you have seen a chiropractor or a physical therapist and are still having really bad back pain or leg pain or what people call sciatica. So I'm going to take you through. We've got Kristen here on the table. I want to tell you a little bit about the table, and then we'll give you some insights into why some of the top colleagues that I have practiced with in the United States also use this table. So the Hill DT table is pretty easy to be set up on, and I'm just going to come in. We've got what looks like a car seat safety belt, and I'm just going to pull that kind of tight and snug, and you'll feel that go right above the pelvis. When we come in with our harness, this is actually going to very comfortably hold the rib cage, and you can, if you look at the table a little closer when you come in, a little hard to see right now, the table has segments in it, and this is the pelvic segment that I am working on right now. So we're stabilizing the pelvis so that when the table pulls, it pulls the thorax, your rib cage, middle area section, away from the pelvis. The angle that we set the table at is very important, and we have different protocols, it's important to note, for different conditions. So when we set Kristen up here, we're going to set it for a lumbar spine, and we have her set up to angle the pelvic tilt to 5 degrees, and we had noticed we have her feet up to level out the lumbar spine. And the reason we have the tilt set it where we have it is that because we're angling and targeting the upper lumbar spine. If you have a problem in your lower lumbar spine, we have a setup just for the disc that is involved. It's important to note that if you have any images, X-ray, and especially MRI can be very helpful for us, so we can see the kind of herniation you have or disc deformity that you have and set up the proper protocol for it. Now, Kristen's going to be given one of these, and go ahead and do this. We've got, here it is. We give you a little call button. Now, I want you to know if you can get out of your own car seat, you're not stuck on this table. But we still give you a call. I'm going to give that to Kristen. And you can summons us at any time if you have any concerns or are not able to get out for the table when you want to. And you're going to be here about 20 minutes. Now, most folks will fall asleep during that time because they've never been under negative pressure in their disc. It's such a good, relaxing feeling that most people will fall asleep during this 20-minute period of time. Once we set the table, it preloads. That means we go up to about half of 25% of your body weight to start. And we want you to know that this machine will know if we're pulling too much. And it will stop the moment it senses you pulling back more than you should be, because it knows, it's very smart and intelligent. It knows when you're going to have a reflex that will tighten after the treatment. And remember, we want you relaxed and decompressed after the treatment so that valuable nutrients and water can be absorbed by the disc. So that's pretty much it. We set you up, you stay for about 20 minutes. Afterward, we assess the success of the treatment. And I'm just going to let you know that this has been one of the best things we've had in the clinic, and make a special offer to the first 10 that call. We can only take about 10 patients a month on this protocol from this offer. So if you get this, we want you to know that we hope you qualify. You will have a free trial. It's part of the screening that we do. We want you to bring any images you have with you and just click the number that we have on here or the link to our website and call the number, and we'd be glad to set up a time for you. Hope to see you soon.